Welcome back to the show, everybody. You know, cholesterol enters your body from food like animal-based foods, milk, eggs, and meat, but too much cholesterol in your body is a risk factor for heart disease. So how can you find out if you have plaque in your arteries, and what are some of the most overlooked symptoms of heart disease? February, by the way, is National Heart Month, as we welcome from the Chattanooga Heart Institute, cardiologist, Dr. Stephen Monroe. It's so good to have you here.
Thank you.
Let me ask you this question. Sure. What is plaque? We think about it on the teeth, but what actually happens in our arteries?
So plaque, what we technically call is atherosclerosis, is a buildup of fatty acids and cholesterol. It's in the arteries of the heart, and we have a model. I can
hold this up here.
Sure. And we have the arteries of the heart were in the red, and they give the blood flow to the heart muscle. And when you have an artery that's enlarged here, and the plaque in yellow is built up over many years, it occurs with lifestyle, genetics, smoking. And when it gets to a certain level, people get angina, and angina is a form of, it's a symptom that's related to a lack of blood flow.
All right, let me ask you this question. Is a lot of it dealt today with medication that can actually remove the plaque? And you would say smoking could be the biggest thing that you could do right now for heart health. Another thing is know your genetics, know the family makeup.
Correct. So the risk factors for plaque buildup or cholesterol buildup is a basket of things. One is your genetic predisposition. Another is, are you a tobacco user? Smokeless tobacco is very prevalent in this area, and it carries the same risk as smoking. Do you live an active lifestyle? Do you eat healthy? Do you eat a diet that's low in fat and low in carbohydrates? Do you exercise, and do you have a body mass index that would be consistent with obesity, another prevalent thing in our area?
Well, when somebody says they had, 4 arteries were blocked, can it now be handled through medication, or do you actually have to go in there for open heart surgery?
So it depends on the level of symptoms and the level of blockage. And so people who have angina that we call stable, that means a chest pain or shortness of breath syndrome that is not associated with dramatic limitations in lifestyle, those people can often be managed with medicine. Sometimes people cannot be managed where they have a comfortable lifestyle or they have unstable symptoms, and those people are best managed with invasive procedures such as angioplasty or stenting, which we do at the Heart Institute, or sometimes we recommend bypass surgery.
A heart attack or heart, we call it heart disease, but they're really heart problems. And one of the biggest things that you can do is a tightness on your chest. We say it all the time, it feels like an elephant is on your chest.
Sure.
Don't wait. That is a huge red flag to get into the hospital immediately.
Very much so. So the classic symptoms of a heart attack or angina are substernal chest pressure, weight-like sensation. Some people call it a squeezing sensation. Some people do have true pain. A lot of people will say, well, it didn't hurt, it was just uncomfortable. That can be would prompt you to get more urgent evaluation.
A lot of people will say, is this heartburn or is this heart problems?
It can be a very difficult thing to know, and it's always safe to be on the proactive side, because if it's your heart, catching it early is very important. It is important to get to the blockage and to the symptoms before you develop a heart attack. Heartburn can mimic cardiac pain. Gallbladder can mimic cardiac pain. Reflux can mimic cardiac pain, but it's important to let a healthcare professional help you differentiate that.
Can I ask you this question? And I know this may sound like a bizarre kind of question, but can too much exercise be bad for a heart?
There's a little bit of controversy in that. In the ultra marathoners, and some people they think can have chronic microvascular, which is small vessel injury from too much exercise, but that's a very, very, very small part of the population. You need to listen to your body, you need to listen to your joints and your muscles, and if you do staged exercise where you gradually increase it over time, it's very safe to exercise as a moderate or vigorous level 4, 5, or 6 days a week.
All right, so in a Heart Healthy Month, the best thing you can do, stop smoking, you can exercise, watch your intake of fatty foods, and know your genetic makeup.
Correct. And just be self-aware and understand, am I overweight? We have a body self-image in the U.S. and a lot of the world now that we don't recognize when we are significantly overweight. Understanding what a body mass index is, where you are in that, and do I need to do things like change my lifestyle with exercise and dietary habits so I get into a normal weight range for my body type.
And oftentimes when you're body type and you think you're thin, but oftentimes there could be fat around some of the vital organs like your heart, and you need to get that checked out as well.
Sure, sure. And we have an apple and pear mentality. When you have a pear shape, where you keep the extra body fat depends on cardiac risk. And so pear-shaped people tend to have a little lower risk. People who have apple shapes, who have truncal obesity, have higher heart risk.
It's great to have you here.
Oh, thank you.
You got to come back on more.
Oh, I'd love to.
All right. Once again, the information from Dr. Monroe at CHI Memorial, but it's Chattanooga Heart Institute, and there's where they're located: Jasper, Chattanooga, Hickson, Cleveland. It goes on and on. Ooltewah, 697-2000, heartmemorial.org. Stay well. In February, it's Heart Health Month.